So, sleep apnea, honestly, the more common name that most people would know by is snoring. Essentially, it is just a disorder in which when you're sleeping and you have that lovely sound. There's actually different types of sleep apnea.
Okay.
So, I mentioned the muscles in your throat relaxing. That's the more common one. That's obstructive sleep apnea. There's also something called central sleep apnea, and that is, I'm not as well versed in that. That's when something like neurologically is going on in your brain that whatever signals need to go on in there just aren't going. There's also called mixed sleep apnea, which, as you might imagine, is what it sounds like. So when you have both central and obstructive, one is not good to have, two is worse. So obstructive sleep apnea, or OSA, is what we see the most in our practice. I'm sure that in our firm we have clients with central sleep apnea. I have never had a client with that. I have primarily dealt with obstructive. The way that the causes for sleep apnea can be a lot of different factors. If anyone's ever gone to a CMP for sleep apnea, a lot of times CMP examiners will review, yep, you have sleep apnea. Could it be due to service? No. And the main thing that they will always pinpoint is if even you're just a little bit overweight, they're going to say the veteran's weight caused the obstructive sleep apnea.
Mhm.
There's a particular quote they use from like an old clinic study that talks about how as the circumference of your neck widens, you can gain weight in your throat technically, but that is not exclusively it. Overweight, but it could have nothing to really do with the sleep apnea for the reason that you're having it. There's plenty of overweight people that don't have sleep apnea.
Yeah.
And again, there's plenty of people of all weights. You know, if you have a neck injury, something that alters the structure of your actual spine, you might have to alter the way that you like sleep on the pillow.
Mhm.
You might have to adjust your position altogether. Maybe you're probably not sleeping that well to begin with, which can make sleep apnea worse. So that's a very common thing. Another thing would be medications. Well, that's going to relax everything. It's not just going to relax maybe your back that's tensing up. It will relax those muscles in your
Yeah.
throat, which can lead to increased sleep apnea events. Also, a huge thing that we see in that the CMP examiners almost will never give at first is the link between sleep apnea and mental health. There's a huge link between veterans with PTSD, increased occurrences of sleep apnea. From what I have learned is essentially, especially with PTSD, but this can also happen with depression, anxiety, any kind of mood disorder where your stress system is it's out of whack. You might have nightmares that interrupt your sleep. Again, you might not be able to get to sleep very well. You sleep poorly. So think about a veteran who has PTSD. A lot of times you have nightmares. You don't sleep well.
Yeah.
You have like a lot of awakenings during the night. That is called sleep fragmentation. If you're not sleeping all the way through and it just kind of fits and starts 20 minutes here, 45 minutes here, 15 minutes, sleep fragmentation can also contribute to your sleep apnea getting worse because your brain is not getting like the signals that it needs to
Yeah.
totally refresh, totally remind you, like, okay, we're going to take deep breaths. That can make it worse. So, say you're in that 45 period of sleep that you get maybe, once a night. Okay, this is my long stretch. And then you wake up because you can't breathe. It just can be like a really vicious cycle. Your nervous system is all screwed up. So again, when you sleep, you're going to maybe like wake up a lot quicker than somebody without those symptoms would have, without that hypervigilance. And again, that just kind of compounds to the point where then the less you sleep, the worse your mood is. The worse your mood is, the worse you sleep. Not only just for the veterans, but if they have spouses as well or partners that sleep with them. I talk to a lot of patients who are like, yeah, I sleep in a different room. Family members, like you're not sharing a bed, but you can hear through the wall. It can affect everybody's sleep, certainly. There's a couple different ways that we get service connection to get it linked to service. So as I mentioned, there's different conditions like chronic pain or something you need muscle relaxers for, or a mental health condition, something that whatever interferes with your sleep. If you're already service connected for that, there are links that have been shown in medical literature. Are there ones that the CMP examiner is going to use? Maybe not. If you've got a primary service connected disability, mental health disorder, chronic pain, so secondary service connection would be the path for those where your snoring didn't start in service. It started down the line years afterwards, but years after you had been dealing with these other conditions, primarily set you up to have that bad sleep and that sleep fragmentation, and over time, how that could lead to sleep apnea. Another secondary potential to link your sleep apnea to service, we talked about weight gain, how the VA always likes to say, well, it's because the veteran had weight gain. That also doesn't factor into our veteran. We had an example with the hurt foot. If your foot is screwed up, your ankle, your knee, your back, whatever, you can't work out the way that you would if you were fully able-bodied. And a lot of times that does take a toll on you. That takes a toll on your overall health. It takes a toll on your activity levels. It can lead to weight gain. But that's not the same as just, I'm just naturally, my family's heavier, I've always been heavy. It's no, you might have gained weight from this particular service-connected event, not able to get it off, not able to work out consistently. Even if it is linked to weight gain, it could still be linked to service. Sleep apnea would be the secondary condition, and you've got a primary service-connected condition. Show a link between those two, service connection. But there's also direct service connection. And in that case, you don't have to even show why it happened necessarily. But if you started snoring in service, you started experiencing these sudden wakes. With your in service, you're either going to be sleeping in barracks, you're going to be sleeping in like a tent, you're going to be sleeping even in just like married quarters with your spouse. You're not going to be usually by yourself. Like you're going to have people who have witness this. A lot of times I'll talk to veterans who are looking for direct service connection, and they're like, yeah, my buddies would always make fun of me. They'd always say, like they'd have to go to sleep first because if I went to sleep, no one else, there would get any rest. I've spoken to spouses who are like, yeah, I actually noticed, when we were on base in the 80s, like he did start snoring more and more. And I found I had to go to the other room or I had to wake him up. Direct service connection. As long as you can show that something started during service, you didn't have it before, it started during service and it's continued since then that's all you need to show. So in those instances, buddy statements are huge. So you don't have to show medical reason that it developed. You simply have to show that it developed during service for a direct service connection. Presumptive service connection doesn't really fall in here. Certain respiratory conditions, of course, can be presumptive, but sleep apnea has not been added to that list. Although, of course, obviously, if you have problems breathing already, there's probably going to be issues when you're sleeping. Most commonly, as an attorney, when I'm looking at sleep apnea, I'm looking to see if a veteran has a CPAP machine. There's also something called a BiPAP. There's different sleep aids. Yes, exactly. That machine is pushing oxygen to you so that even when you are taking those maybe shallow breaths, you're taking those breaths and you're waking up with sleep apnea because you're not getting enough air. So the machines help it so that the air is right there. It's being like pushed essentially into your airways. So that really helps people who have sleep apnea. They're not getting those signals to their body like, wake up, like you're not breathing, because they're getting that air through the machine. So if you need a CPAP or a BiPAP, or if you've been prescribed, okay, that's what's important, is that has a doctor prescribed this? And I say prescribed because the last couple years, there's been a shortage of the machines. And I've seen this in VA records where a doctor they'll do a sleep study. They'll say, CPAP titration is recommended, but there'd be a note about, there's been recalls on some machines and there's been unavailability. That may have something to do maybe with COVID, like maybe they repurposed some of the respiratory. Yeah. I'm really just guessing. Yeah. But I say prescribed because yes, ideally you would have a CPAP machine or a BiPAP. But if a doctor has recommended that you have one and you're not able to get it due to shortages or supplies, the fact that you have sleep apnea bad enough to need one is a 50% rating just for the sleep apnea. Again, I'm going to emphasize that one more time. Yeah. If you have been prescribed a CPAP or a BiPAP, even if you don't have it because of shortages, you should still have a 50% rating. What you need to do is show the prescription, like the doctor's record, just showing that it was recommended. That should be enough proof. Now, sometimes I will talk to veterans. In the past, I've talked to veterans who I'll say, you got sleep apnea? Do you have a CPAP? Yeah, but I don't use it. Okay, well, you need to use it again, but the fact that you've been prescribed it is enough. There is a higher rating. I have never seen this in my practice. There is a 100% rating, and that's when you have chronic respiratory failure. Usually that's going to be in combination with some other respiratory disorders. It's not usually going to be just from sleep apnea alone, although it can because it's in the ratings. So I'm imagining there's at least, a case or two where that's happened. I have not seen it just in my practice. So I can't really speak too much to that.
Yes.
Usually 50% is kind of the sweet spot for sleep apnea. There are lower ratings. So there's a 30% rating if you haven't been recommended a CPAP or other breathing machine, but you do have documented sleep apnea. And in the rating criteria, it calls for persistent daytime hypersomnolence. So all that means is you're sleepy throughout the day. This is, again, the 30% criteria. It's a fancy way of just saying like you're tired all the time during the day, regardless of how long you spend in bed, because you can be in bed for 10 hours. But if you've got sleep apnea and you're constantly waking up and having these events, you're not going to actually feel rested, regardless of what time you wake up, regardless of if you take a nap, regardless of if you're drinking coffee, you're still tired all day.
Yeah.
It's because you're not getting enough oxygen. So even if you don't have the prescription for one of those machines, but you're just exhausted and fatigued all day, and it's because you have sleep apnea, like you're just not breathing enough. 30% rating. Anything less than that, like say you have a diagnosis of sleep apnea, you're actually getting rest, you're feeling okay throughout the day, but you do have that diagnosis, they will service connect you, but you get a 0% rating. So it's just not really effective. I do always say, like, if you have a diagnosis and it is linked to service, even if it's not bad now, it could progress. I always encourage veterans, like, if you have these symptoms, you should file for this claim or you should pursue this. Maybe it's not to the extent that it's so serious right now. Consider looking into it because it is something that can progress over time. I mean, it's something that you can get a 50% rating for. So it is something that I would definitely encourage if you have it, if your partner has said you snored, if you fall asleep in the living room, your kids have said you snored, your friends have said you snore.
Yeah.
Maybe look into it, especially if you're finding that you're tired a lot, but that persistent daytime tiredness, if you're noticing that, that might be something to mention to your doctor about. Respiratory conditions are rated a little differently if you have multiple conditions, but certain respiratory disorders can't be rated separately. So for example, if you have asthma and sleep apnea, you're not going to get a 50% rating for your sleep apnea and a 30% rating for your asthma. You're not going to get those both at the same time. What they're going to do is say sleep apnea with asthma. They're going to combine them together and you'll get whatever the higher rating is of those two conditions. So they would add your asthma in to your sleep apnea rating if you needed a CPAP and have that at 50%. You would no longer have a separate asthma rating. I just do want to let veterans know, or anyone watching this, that is something to consider. If you do already have a respiratory condition service connected, that may be something that you're not going to get that full additional, like say 50% rating for sleep apnea.
Yeah.
It may be something that's added to your existing conditions.
Thank you everyone for watching this video. Remember, hit the subscribe button, hit that like and share if you can. As always, thank you for your service and have a wonderful day.